Today, I'm meeting Kristina Valdez from Pennsylvania, who has been relentlessly providing childcare facilities for those needed the most. Affordable childcare is among the most pressing issues for American society today. There is a severe lack of access to affordable and quality care, forcing parents, especially mothers, out of the workforce. Childcare costs have been prohibitive, put a strain on the entire family budgets, and creates widespread childcare deserts. So, Christina transitioned to nonprofit work after personal challenges. After going through a divorce, she felt the pain of raising kids as a single mother and the support that single mothers need, which led to the birth of the nonprofit along the way. In my conversation with her, she discusses the founding of her organization, challenges faced during the pandemic, and the importance of addressing childcare issues. I asked Christina on how this problem can be solved on a mass scale, and she had some innovative ideas as well. So please welcome Kristina Valdez at Unsung and Unstoppable. So, Christina, welcome to the show, to Unsung and Unstoppable, and where we really take those amazing stories that goes behind the nonprofits, particularly the people who make things happen at these nonprofits. So we've spoken earlier. We've had a brief chat, and what I really want to understand as I start speaking to you is you spend a lot of time in education and healthcare after you graduated from Penn State, and that was for quite a number of years. So, what made you switch to a non-profit? How did it happen? Was it an inner call, or was it that you met somebody on the, you know, somewhere and bumped into each other, and that was a life-changing decision? So,
Yeah. Yeah, I did. I did spend some time doing research and in academia and worked at universities, and I loved doing both of those things. I kind of fell into nonprofit work by happenstance. My story is that I got divorced. That was kind of the precursor to this new career path. And I found myself as a single mother after divorce. And my divorce lawyer actually said, you have to go back to school. I didn't anticipate going back to school right away. I thought I'd get like my master's or, continuing education when my children were older, because they were 18 months and almost 4 at the time. And I took her advice and I went back to school and I got my master's in social work. And I picked social work because it was so broad. I could, work in direct service. I could work at a university. I could teach. I could do so many different things. And ultimately, what brought me to this job was my current husband. So I got remarried,
okay.
and he found this job. It just popped into his LinkedIn. It was, a nonprofit. I had not considered doing this type of nonprofit work before, although I always in my personal life volunteered and like to help people, but I wasn't imagining that I would be running an agency, right after grad school. But, it came into his inbox, and we were dating at the time, and he said, oh, I think you'd be so good at this job. Like, I'll watch the kids for all your interviews. And I had 5. So that was a really big blessing.
So along the way, when was it founded? When did you join midway, or I mean, how did it happen? So
Yeah, so in 2013, 3 women were just praying, and they went to church together, and their pastor had said to them, I think you would be good at doing something to help women. And that was it. That was the only directive, as they tell me the story. And with that, they started praying about it and asking the community, well, what do women need that they don't have? And this issue of childcare kept coming up. One of the founders was she was a pharmaceutical consultant. Another one was a therapist, and the last founder was running a community theater at the time, and she was like a film person. So nobody had childcare experience at all, and it really just grew from being responsive to what the community was saying. And that was back in 2013 to 15, and then we started services in 2016. So we did that for many years, from 2016 to currently, so 9 years. But we did it in a very small way, raised private donations to help a handful of women at any time, and I got hired in 2020. So at the end of 2020, and the organization has shifted how it looks, maintaining its core mission to support people and working families, but it looks pretty different now.
So, so the first initial 5 or 6 years before you came in, uh, uh, I mean, what was it like? So you came in at a particular bad time, or to
Yeah,
turn things around. So what was it like? What were the
yeah, I
initial
came
struggles
in.
like? I'm sure
What was that?
what we want to hear. So,
Yeah, I came in during 2020 COVID. So the childcare was shut down for a while in the state of Pennsylvania through governor's order. And so we were also shut down, and there was just kind of bare bones, like some social media posting happening. But we were shut down for 9 months of the year, and I got hired in September, right around the time that childcare started getting back up and running. And whew, it was a wild ride, I'll tell you that. So the first few years of its operation, it was just really small. There was one person that worked here, one or two people outside of the child care providers. So the core service that we provided and still provide is in-home childcare, like a nanny, to fill in the gaps during non-traditional times. So we had a director who was like the fundraiser, the director, the founder, the marketing person, one paid employee at halftime. And then we had childcare workers that would help the moms and go into the family homes. Uh, it was very stressful. It was not sustainable. It was just kind of asking neighbors and people from church for money to help people that don't have, and very grassroots. um, and the founder, she worked like 60 hours and got paid for like 20, because we were just trying to raise private donations with a very small team. And I wasn't here at this time, but I did it like this for 1 year. I kind of kept the model, and I'm like, I'm the new kid around here. I'm gonna just do what's been done for a year and get my feet wet. And after that year, I thought, no, I'm not doing this. Not doing it like this, because it was so draining, so exhausting, and I felt like there was no way to really grow this. And the social worker, the justice part of me was like, it's not okay with me that only the few people that happen to find us get support, when there's over 300,000 single mothers in Pennsylvania.
and I
So
think,
that
and
was
I
like,
think,
yeah.
and Christina, I think that's a very important point that you made. It's childcare is such a pertinent issue in America that it's become part of election campaigns now, right? So tell me something. I mean, uh, according to you, how do you really, not from a politician's perspective, but how do you really solve this problem? I mean, is it that you need more of government support? So is it a private, non-profit, public part? How will it get solved? That's what I want to. Because I mean, as you said, I think it's more than 300,000 if you ask me, in the entire state of
Yeah.
Pennsylvania. So, uh, so you having seen it firsthand, how can this problem be solved? What's your opinion about it?
Yeah, I do. I do have thoughts about this. So I think that it has to be a shared investment. I think there could be
Yes.
two different things that could work. You know, there have been countries and states that have, from the top down, invested. You know, at a local government level or a national level. The state of Vermont just started a tax, just kind of like an extra tax on. I don't know if it's on sales or income, but I think it's on income, and it's a 1% tax, and it pays for all universal childcare in the state. So there are ways to have it be a top-down approach and work. However, in Pennsylvania and probably more likely in across the U.S., I think there needs to be a co-investment model where employers, workforce boards, public funds, foundations are all working together to share the cost burden because it's just too expensive and ongoing.
Yes. It has to be a shared investment, because I mean that's exactly what I was wondering, that on the non-profit sector alone is it will be impossible for them to solve the problem, and you can't just scale it up, overnight, unless you really have those. So tell me something. So federal grants or state grants, I'm sure you, when we talked the last time, you were talking to me about a big grant, that, but we'll come to that a little later. So tell me something. How was it to work with the founders, or with the other team members in the initial days? So how did you really work together to? How was the team like?
In the beginning, like
Yeah,
when I
when you.
first started 5 years ago.
Yeah.
Yeah, so uh, we didn't have any grants that we ever received. So I think there was some attempts to get grants by the founders and the people that came before me, but they had never gotten any. So it was largely the founders who were, you know,
Yes, who were probably.
subsidizing the mission, right? Like their friends, they were I don't think many people realized that, but that really was the scenario. And so when I came on and we needed to fundraise, and I didn't know all of the founders' friends and church going, community, I asked them, well, how did you fundraise? Because fundraising is like really hard. And they said to me, we didn't. We just, we would just like pray and trust that God would provide, and then, you know, he did. And then I was like, oh, okay, well, uh, hmm. I don't know how to replicate that, but okay, like it was kind of like this moment of like there was such beauty in that deep trust in the mission, and it's not something you could really scale. It basically relying on the generosity of other people. You can't really operate a nonprofit business that can grow with that type of, inconsistency. So, I now later, have come to realize that most of the time it was like their hearts were moved, and they were the ones that had provided, or someone very close to them, which is, I really admire that, because I think if they would not have just said yes to the whisper in their hearts to start this, I don't think it ever would have happened. It couldn't have taken a logical form in the beginning, because it makes no sense from like a capitalism, like, perspective. You're giving uh, to low income people what usually only the top 1% get, a nanny when they need it. Um, so I'm really grateful that they didn't think about like the mechanics of it and how this would sustain, because if they did, they probably wouldn't have started it. It was started on faith, and with that radical trust, it was able to even grow and exist.
So, I mean, Now, this brings me to something, some curiosity that with your two kids, and how old are they now, the two of them?
10 and 12.
10 and 12. So they were not 10 and 12 5 years back. So they were they were 5 and 7. So how did you
Yeah.
manage all this? I mean, it was not easy, I'm sure.
Oh, it was so hard. It's still so hard. So, you know, my my heart for this is very personal because I was a single mother when I got this job. I had lived I had lived being a single mother with resources. My ex-husband is a physician. He paid his child support. I was able to go to grad school, so I had a lot of privilege even in my single mother status. I never worried if I had enough, money to buy food. And still it was so hard. Like I was like waking up at 3 in the morning to do my assignments when I was in grad school, getting the kids to school by 7, driving an hour to go to work, gone all day, and then come back and do it again. And you know how difficult it was for me with resources has been my motivation to keep growing this, because knowing that it was that hard with everything I needed and a support system, I can't imagine, not even for a moment can I fathom what my lived reality would have been like if I had no one to rely on, no family support, and I didn't have like material needs met. And that's all of our families that we serve. If they had material, if they had family support, they wouldn't be calling us to watch their kids, strangers, right? So, like, the families that we serve are those who really don't have any natural support system, and that's what keeps me going, like, every day. Awareness of the privileges that I have and how it's still so hard. Um, so it doesn't quite answer your question of how I manage it, but it
But
hopefully
you did manage
answers
it. No, you did manage
why.
it. And you managed it well. We can see that, right? So it's been,
My kids know all about. I'm like, my kids could probably like run a nonprofit. I'm like, they're hearing everything. I'm writing the grants. You know they're getting exposed to what it's like, to run a endeavor that helps other people in a pretty tough environment. So yeah, I kind of bring them into it as a way to balance things a little bit. Otherwise, I'm just kind of consumed in my world, and they're like, "Mom, what are you doing?" And they like to hear about it. They're very interested now at 10 and 12. They even give me some ideas sometimes because they see the world in such an unfiltered way that, their perspective is oftentimes like spot on.
nice. So, okay, over the past, it's been almost 5 years since you've been there. So tell me a little more about the programs. How did you scale up? What are you doing? A little bit about that. So,
Yeah. So we've always done our childcare service, our in-home childcare. That's been our core program. But we realized that there were a lot of other needs that these families had, like the families that don't have a support system and haven't had resources available to them. They don't just need childcare. Sometimes they're transportation insecure. Sometimes they're housing insecure. They might need help applying for benefits or a job referral. Like, there's a lot of needs. And one of the really disappointing things about, life in the US is that everything is so siloed. If you are someone that needs support, you probably have to go to like 5 or 10 different places, fill out different forms, all with very little resources and probably working 3 jobs that don't even pay as much as, one full-time job. So it's very, very hard to get yourself into a better place on your own. And so, what our agency does, and what we've always done, uh, and have leaned into over the last 5 years, is to be like the connective glue between workforce development programs and employee referrals and social service agencies. And so it's once the client comes into our network and works with us, then they don't have to run around to all those places. We have partnerships with other agencies, even with behavioral health to provide mental health services, training programs, employers, so that what the person has to do is work hard. That's what they have to do. They have to work hard, and then we kind of have a path that they can walk easily without falling through all of the I think of social support in the US as like a net that actually has like huge gaping holes. So instead of asking folks to walk on the net and not fall into one of the very many holes, we piece the net together and we ask them to walk. They still have to do it. They have to do the work, but we make it doable. And so the programs now are the childcare program, still the in-home care. That's the hardest program to scale. It's the hardest to fund because we pay our childcare workers a living wage. And then we have the cost of, insurance and all of the due diligence, clearances, and training for caregivers. What the families get is the equivalent of like a high-end credentialed nanny. So that costs a lot of money, and we try to get private donors to provide scholarships for families for that service. And then we have a TriShare childcare program. That is a program that employers pay 33%, parents pay 33%, and grants cover 33% of the cost of center-based childcare. So, we have a bank right now that is participating in that program so that their tellers can have, reliable childcare at a center, but the cost for the employee decreases by 66% because the employer pays 33% and then our agency matches their contribution 33%. So that's the other childcare program. So there's 2 childcare programs. And then we also have a car purchase, no debt car purchase program that requires the person to save $1,000 and do a short financial literacy course. And then we match their $1,000 with $2,000, and we have another nonprofit that matches $2,000, so that the person can buy a used car for $5,000, not have a debt payment, and stop paying $900 a month to take Uber everywhere. Because that's what ends up happening. It's so expensive to be poor, basically.
Absolutely. So, and I just just take one point from what you said earlier. They're basically getting the same quality of services as the top 1% of America, and that's fantastic. So typically they will be in the median income range of 50,000 a year, or 35 to 50,000 is what I guess they will be in the median income range.
Yeah, it depends really because we go by the very outdated federal poverty threshold. We have, because it's so outdated and doesn't take into account the cost of inflation and the very non-inflated minimum wages, those have stayed pretty stagnant. We extended it really far out to 350% of the federal poverty threshold. So that was to make sure that the people that are working but still struggling to make ends meet because everything costs so much could still get support. Usually programs cap their assistance around 200% of the federal poverty threshold, which means that only the most under-resourced families can have any type of services. And the problem with that is once you start gaining stability, you need a long runway. Planes don't just start flying from not flying at all till they're up in the sky, right? Like planes need a runway to gradually start getting into the air. And so that 350% threshold is our way to give people a runway and really help them get stability outside of just immediate dire crisis. Does that make sense?
Yeah, that. And Christina, I'm sure there will be a lot of households, a lot of these households who are single households. Like, I mean, people who are single moms or single dads who would require a lot of these childcare support. I'm sure those are also a lot that you get.
Yes.
I'm
Oh,
sure.
yes, absolutely. Yeah. I mean, it's really an issue for two-parent households and single parents, but the single parent households are the most in need
Yes,
because,
I guess.
we basically are like the other parent. Um, and so it enables them to go back to school or to do night classes or to fulfill a mandatory, evening or weekend shift at their job so they can keep their employment. So, filling in these gaps like really makes such a big difference in the ability for them to show up to work or advance their training. And that's really the goal for them to be established in a career, to be able to get the education that they need within that career so that they can not need us one day. Like that's, we want economic mobility.
So, Christina, how do you define yourself? Do you define yourself as successful in your role?
Ooh,
Successful have you been? We want to hear that.
that's funny. That's a funny question. So, you know, uh success is a funny thing because,
I'm talking specifically about your role at along the way. I'm not talking to you personally.
yeah,
So,
yeah, I mean, I think that we're on the right track.
okay.
It's very hard to get co-investment in in this society. I'll say that because we're so individualistic, it's so siloed, and so this model is really challenging. Uh, in some ways challenging norms, cultural norms, and it's not doing so without good reason because our cultural norms of individualism and siloed services are ridiculously expensive financially, on a social level. Human outcomes are bad. I mean, you've probably, anyone can look in the American news and see something's not quite working, right? So there's good data to underscore the model that we have, but the American psyche is just very much individual, and we're saying like, no, we need to all work together to cover the costs of this. And even if you don't have kids, you benefit when your neighbor's not in poverty. And you benefit when your coworker stops calling out of work because they have childcare now and they can pick up their fair share. Like, just because you don't have kids or directly benefit, we're all in this together. And whether someone recognizes it or not, it impacts them. These silos that other people experience, and employers too. The cost of hiring and retraining people, it's so expensive, and they know the cost of that. So it's all of the things that we do are very much data driven and evidence based, but the cultural narratives, they're not data driven. And so that's where like the biggest challenges are right now. And the only way to really get success around that obstacle, because that's a big one, is trust building. And trust building takes a really long time. So that's kind of where we are now. We're in year 3 of this project, this co-investment project, and I think we've seen some successes. I've certainly seen successes on the family side of things. We've seen families that are deeply under resourced, like women who grew up in foster care, who have no family whatsoever, no one reliable in their life, become nurses and make as much money as I do, like, or even more sometimes. So able to support their kids, and that's to me that's why when I got here, I said I have to grow this program because it's too good for only a handful of people to be able to access because it actually works. It works to help even the person that is the most under resourced, that comes to us with no career, no education, no family support. If they're motivated to do the work, it works. We've seen it. So that's the thing that I'm trying to grow, and we're working so hard to let people know if there's not a deep, if the social safety net isn't chock full of holes, when it comes together, people actually walk across it and they get to the finish line. We've seen it, but it's hard.
I know.
It's hard for folks in the US to believe that because it's just we've been deeply siloed and I would say ineffective in supporting people for forever.
So what next?
Yeah, there's a lot. So I think the
So what
biggest
next for
thing
the
next,
next? Okay, so what next for the short term? I mean, let's not
yeah,
think too much into the future, but what are the plans? What's the plan at your end and the non-profit's end? So along the way, so both together. How are you
yeah,
together driving this and going forward is what we would like to know.
yeah. So I think the biggest thing that's next is we're making a platform, like an app, that will allow us to work with other providers in an effective, holistic way. And one of the challenges to doing this holistic model where people have everything they need at the same time
Hmm.
is very operational. It's there's a gap in software. There's like software that costs like $60,000 a year that can do all the things that most nonprofits will never be able to afford. And then there's like Excel, right? So like there's very little in the middle that will allow you to work with other partners and not in a non-siloed way. Like we don't have to do everything, but we have a partner who helps with the car purchase program. That's another nonprofit. We have a behavioral health partner that prioritizes our referrals, and we even co-invest sometimes. It's really important that we have some kind of tool that allows very busy nonprofit employees to quickly make referrals, see that they're accepted, work together, and then to see that there's what the ROI on that is together. To not have to remember to call up the caseworker or get in touch with the marketing person or the CEO to know, well, what was the impact of that? And the same for donors too. Like when donors give us money, right now it's so hard to be able to easily say to them, this is what the impact of your sponsorship was, because it requires us to capture data in one system, then translate it into another system, and then eventually find a way to package it that they'll understand. So the platform is really to alleviate all of those pain points so that when someone gives us $1,000 for a child care scholarship, I can give them access to the portal showing that client's de-identified progress. They can walk alongside that person and see what that money has done for them. Same thing with foundations that give us support. I can then give them access to the back end and they can see all the clients that are linked up to like the support that they gave and their de-identified progress. And that to me is part of what's missing for nonprofits. Like you kind of just expect people are going to give you money and trust you to do with it, good. But that doesn't really work for scale. Like people give to what they trust. So that's kind of the next thing that's happening now. I'm currently doing that like in my free time. free time
That's if you have the free
because
time. So,
yeah, I have like no free time, but I'm currently doing that in my free time, which is like probably time I should be sleeping. Um, but to me, it's really important to not just create a, not just create something that could work for us, right? Like it needs to be something that can be duplicated over and over and over again. And that's always been my stance because there's 300,000 single parents in Pennsylvania. There's probably millions across the US and many more millions across the world. So I'm always thinking in terms of how can we do something that's easy to adopt, that's scalable, repeatable. And so that's what this platform is because it's been 9 years of trial and error, figuring out what doesn't work and what works within the system that we have. And we have a pretty firm grasp now of where the hangups are, what stalls people, uh, what we can make more efficient, and we're putting that all into this platform. And then we'll start testing it out with our partners. So it's about like 60% complete. And then, we have a range of partners, the car purchase, the behavioral health, we have other nonprofits we work with. So we'll invite them into it first to kind of do a very local test, kind of like the MVP, minimum viable product test of that and see how it goes. But something that I did not anticipate was becoming like an app developer. That was something that uh, kind of took me by surprise. But here we are, like the only thing that I really know how to do is try to figure out how to do things yourself if you don't have the money to just pay someone to do it. So that's
so I'm curious to know of this software of $60,000. What's that software? What's that? I mean, the big thing.
oh my
What
gosh.
does it
Yeah,
do?
like there's a
Does it
whole
change
bunch
the
of
world?
soft.
Does it change the
Yeah,
world?
yeah, there's a bunch. Usually it's like software that interacts with health systems
Okay.
software. So like my husband runs a foster care and adoption agency, and they have software that will interact with like electronic health systems, and there's like back and forth. So it's complex software, but most nonprofits, they don't need that and they can't afford it anyway. So I'm trying to find this, fill this gap. And we have tried different softwares that are even free. We're definitely not trying to reinvent any wheels if something exists. So we tried a software called Unite Us, and that is like referral software for different partners. And the challenge with that was, even though it was totally free and it was like really made very well, it relies on the other agencies like being like invested and signed up into it. And so in our local area outside of Philadelphia, there's very few agencies who are in that network. It's a closed network. And when we started using it, we would ask them, "Oh, can you sign up to do this?" But it's like asking a nonprofit, who's already burnt out to like learn new software, and it just didn't work. Like we kept trying to get other people and other agencies to use it because if we don't have anyone else using it, it's useless to us, right? Um, and that's only in our area. I know another nonprofit who's in a different part of Pennsylvania, and they have a lot of users in that system, other providers, and it works really well. So, it's just our region. It wasn't they weren't picking it up like that. So that's what I'm trying to solve for. Like the what I'm building is compatible with Excel. So even the least sophisticated nonprofit could use it. So I guess we'll see what happens. Maybe
So,
we'll talk again.
so, so are you telling me that you've become a product development uh, go-to person as well? I mean, so it's
Yeah, I did. And I can't take total credit for it. We did go through a company we started making an app with an app development company. We got through the whole design phase, so I met with them like every week for almost a year. And at the end of that design phase, the price really jumped for the coding. It was like almost double. And so I just stalled. I said, well, we don't have the budget for double. I heard like expanded scope. It's like the phrase that they always get you with. Oh, there's been expanded scope. The cost is double now. And so I just couldn't accept that. I thought it was I thought it was unjust. I didn't feel like we could utilize the small amount of funding we have for a scope that really was misunderstood, by the app development company. So I just paused it, and then I started exploring, well, what can I use? Well, how could I possibly create the MVP with, low code software, and also with AI, using AI to help me code something. So that's what I'm doing. I'm just, I'm pretty good at using AI, and 60% done with the MVP, and it won't be the end all, like app that scales across the US, but it will save us like $200,000 in, creating something that's usable that we can test out. And I think having something usable that is that has data, will help us to get funding for that app that could like become like a scalable throughout the U.S. App.
I mean, it's great to hear. I mean, I don't know. I've not heard about any other people who are developing apps in addition to running programs at non-profits, but I think that is great. So, Christina, what else? Any other thing that you would like to share?
Um, I guess I don't know who's going to be listening to this, but I can imagine other nonprofit employees and leaders. I
Excuse
know
me.
it's just so hard. The work is so hard uh, on so many levels. And I guess I would just say, like, don't be afraid to fail. Like, because if I was afraid to fail at any of these things, then I wouldn't really try them. And the biggest failure would be not trying, because we know that the system that we currently have in the US of people just going to 10 different places and still not being like having improved lives, right? Like they get just a little bit of what they need at each place. That's a complete failure. It's a complete failure of human dignity, of human potential, and it's a failure of financial stewardship. It costs so much money to do it that way. So I would say to just don't be afraid to try something new, because you can't fail worse than what our American system is currently doing. That's a little bit bleak, but I'm trying to be hopeful for all the people who might say, oh, like this, we can't do this. And it's like, well, I mean, you can. So.
I think that's the whole thing of Unsung and Unstoppable, is to inspire others with these stories. I think that is very important. So, thank you so much, Christina, for your time and the lovely story that we've heard. And I wish you personally and your organization along the way the very best for the future and the days to come. And I'm sure there will be many more of these families that you'll be able to impact with childcare, which is such a very pressing, I will say, very, very pressing issue of your country. And thank you so much.
Thank you so much. I'm really excited to listen to the other stories, to read about what others are doing. It's a really great project that you have here, because there are so many of us that are just doing this work, and we don't have any marketing budget at all, so nobody hears about it. So thank you for your work as well.